My name is Dr. Suhel Kotwal from Kansas City Joint Replacement and Sports Medicine. I decided to be a doctor because I was fascinated by the workings of the human body and the biology and mechanics behind it. Right in my high school days, and always knew I wanted to be a surgeon, but chose orthopedic surgery in my medical school days. I was inspired by my teachers and mentors to go in that direction. I completed additional training in hip and knee replacement surgery, spine and scoliosis surgery, along with musculoskeletal oncology. The common surgeries I do is hip and knee replacements, including the management of their complications. Those are infections and revisions. Spine surgery that includes degenerative conditions and deformity correction, and removal and reconstruction of extremities after cancer. My approach to patient care is I always like to treat everybody thinking that they're either my parents or my siblings, and I make all decisions thinking that they are sitting in front of me and I'm trying to do the best for them. I would like my patients to know that surgical treatment is always the last option. We choose after exhausting all options for non-operative treatment first, and the decision is combined. They are always involved in the decision-making process, and after the risks and benefits have been explained, the pros and cons have been delineated, a combined decision is made. After I completed my orthopedic residency, I pursued subspecialty training in orthopedic cancers, which involves bone and soft tissue and other musculoskeletal tumors. My patients include kids in the first decade of life to elderly population who suffer from these conditions. These are rare and challenging and intriguing conditions which are very gratifying to treat.